Welcome to GW Integrative Medicine, the podcast about disease prevention and health promotion from the Office of Integrative Medicine and Health at the George Washington University School of Medicine and Health Sciences.
I'm Dr. Lee Frame, Program Director of the Integrative Medicine programs here at GW.
And I'm Janet Rodriguez, the office's Administrative Director. Today, we're talking about integrative nursing with Sangeeta Agarawal, RN, MS, CAS, founder and CEO of Helpsy Health.
Helpsy is a whole health and AI nurse that anticipates and addresses cancer patients' physical, emotional, and social needs.
Along with her duties at Helpsy, Sangeeta is a symptom management researcher and cancer nurse, that's research and clinical, at the University of California, San Francisco Osher Center for Integrative Medicine.
Prior to that, San was a cancer nurse leader at the Stanford Cancer Center, hematology oncology nurse at the Mayo Clinic, and a software engineer. If you use mobile video technology, you have her to thank for that. Welcome to GW Integrative Medicine, San.
Thank you so much for having me here. It's truly an honor.
Absolutely. The honor is ours as well. So why don't you start us off by telling us a little bit about integrative nursing? What is the essence of integrative nursing?
Yeah, I think nursing, the profession of nursing as a whole, it started with providing a whole health approach to care to individuals and providing that continuity of care to a person throughout their life, from the point of birth till death. Nurses are part of an individual's life, helping them to stay healthy or to recover from their health. So I think the integrative or the whole health aspect was a holistic approach was always baked into nursing and the philosophy of nursing. And I think now with us talking about integrative medicine or integrative nursing, or defining what integrative nursing is, I think it gives us a chance to highlight those key things about integrative nursing. So when we talk about integrative medicine or a whole person approach, that's essentially looking at an individual as a whole, because our body, our mind, our soul are connected. If we are restless and uneasy and anxious, then it's going to affect my breath, which is going to then affect how I feel, and then that may affect my sleep and other activities. So the body, mind, and soul are connected, both from the development of disease as well as healing that occurs to recover from those diseases. So I think understanding that is crucial to us being able to address that individual as a whole. So looking at that whole person approach is really important. Also recognizing that human beings have the innate capacity for health and well-being. We are designed, our body is designed with a defense mechanism and this capacity to heal. And it's important for us to nurture and support our own healing. The other key aspect when it comes to integrative nursing is how we can develop our day-to-day life and activity so that it's healing and restorative in nature, and being able to educate about that. And what's really important in this whole thing is leveraging evidence-based approaches to care, because that's what separates us from knowing something that's a one-off or true for one person versus something that we know is based in science, based in knowledge, based in studies that are conducted and can be applicable to certain scenarios and replicable in those scenarios. So using evidence-based modalities, evidence-based knowledge in how we are pursuing integrative medicine knowledge, and application of that knowledge is really important. And also the other key aspect, I think, when it comes to looking at integrative nursing is looking at the community, because we we operate and our lives are interconnected with those around us. So how do we involve the family and loved ones into the care of this individual, or how do they impact each other, as well as how does the environment around you impacts you, whether it's the work and how the work impacts you, or the socioeconomic factors in an individual's life, or other factors that may be impacting that aspect of health. So I think all those come under um, looking at the whole integrative health approach to care, and hence integrative nursing approach to care. So I would say those are some of the key principles in my mind.
For anyone who has ever asked the question, what is whole health? I believe San just wrapped it up in a bow for you.
Yeah, there you go. Yeah, that's a very difficult concept that you were able to distill down. And I really like how you talked about it sort of building on the foundation of nursing, conventional nursing, and you're sort of adding elements on top of that.
Now, San, what can integrative nursing bring to the patient-provider relationship?
So, healthcare has been so much. I'm trying to figure out how to condense and give you a short answer for this one. So much. I mean, the very foundation um, of a relationship between a healer and a patient is that of trust, of empathy, and um, of helping that individual, with their physical, mental, spiritual health. So that's the core of where health comes from. If I don't feel comfortable and confident in my provider, or in the relationship I have with my healthcare team, or I don't feel heard, I don't feel like I can trust their recommendations, or that they're not addressing all aspects of my health, then that healthcare is in need of more support. And I think that's why integrative nursing is so critical to it, because we need to look at that individual as a whole. And it doesn't take a lot of time. It just takes that mindset of, when you walk into a room, this is not patient number 43245 cancer patient, but this is Mary, who is 60 years old, and she has a family, and she has breast cancer, and she has 2 dogs and a cat, and grandkids, and she wants to be able to play with her grandkids. And she's struggling with cancer, but she's also trying to figure out how to manage her diabetes and her weight with it. And she's scared, and she's anxious, and she's worried financially, and she's worried about bothering her family about rides. Like, those are all part of what is Mary's world. And I think just having, being able to look at that individual as a whole, it changes the way we can offer care to that person. And it's a reframing of our mind. And I think all of us can do that, and that will make it better in terms of the relationship. And then seeing how we can provide provide actionable hope to that individual in that moment, and in the time that they need to take care of themselves, from multiple factors, because we are spending very little time with that individual. So what I'm trying to say is, in that moment, being present with the individual fully, seeing them for who they are, and being able to provide them guidance and support that addresses all these aspects of their life that interconnect, would be critical, to how, what we can bring to the provider patient relationship with this whole health approach. And I think the other aspect of it is, if we are able to help this individual with the continuity of care, they see me today but they may not see me for another month. If I can guide them, or give them some kind of support and what they can do every day to empower their own health, then that will be something that's very positive for them. And that's what integrative nursing can bring, because while they may not have full control about, in this case, Mary, for her cancer, she can come and get her treatments, but whether she recovers from cancer or how much she recovers, that may not be something in her hand that she can do every day. But she could do meditations to calm her mind. She could go for a walk. She could eat healthy. She could spend time with her family. And those would be things that would be nurturing for her body and for her mind and for her soul and for the family that's there with them. And I think those are the kind of things that integrative nursing brings to that patient provider relationship, because it's a bigger spectrum. Um, it's a um, it's a more comprehensive, broader view of that individual.
Lee, would you say that applies to all health professionals?
That's a great question. I think that's the whole idea behind the integrative medicine approach, is that you can come in and see a patient and give them your recommendation based on what you've seen in their chart. But if it doesn't work for their lifestyle, their family, everything else that they have in their world, then it was completely pointless. And I think that's exactly what you're trying to get at, Sam, that we need to focus on the needs and the abilities of our patients to give them the tools that they need, individually personalized, to be able to maximize their own health. A lot of the things you're saying, they're going to do themselves, right? They're going to meditate. Right. We're empowering them.
Right. So true. So truly. I mean, I think what do you see? Because, running this integrative medicine program, I think it's so phenomenal, because like you said, it's about empowering that individual to be able to do what they can do. How do you see that different in the relationship than a traditional patient-provider relationship? Or how does that enhance your relationship in some way or make it different?
Yeah, I would definitely say it's different. The first thing that we talk about in our program is that you're really more of their co-pilot, whereas I think historically physicians took more of a patriarchal role, like, I know what's best and I'm going to tell you what's best. And now it's like we're more working with the patients and guiding them and making sure they have the resources that they need and referring them out when need be to maybe in-home nursing or registered dietitians, whatever other resources they need. But it's almost, one analogy I use a lot, it's kind of like a quarterback role, right? So you're working together as a team and you're orienting the healthcare system so that it actually helps the patient the way that they need it. Because a lot of times people get lost in the mix. I know I had this experience personally where, and you said earlier, the patient feel seen. And that's something that I think a lot of people lack when they come in the traditional model. They feel kind of like a cog, and it doesn't really work well for everyone. And I think this whole movement of like personalized medicine is really starting to elucidate part of the reason that doesn't work. Is every person is not the same, even biologically, let alone with all the socioeconomic and other factors that come in there. So I think looking at them as a teammate is probably a better model than the traditional patriarchal model that we've seen in the past.
Yeah, so true. I mean, I think, it's about understanding their priorities. What is their goal? What are they trying to get to? And then seeing how can we help them to get there. And then it becomes more of a joint relationship, a co-pilot, like you said, where you're working on this together rather than us, telling somebody do XYZ, because that, you know, that doesn't work. No, nor is that, I
No,
think,
it doesn't work.
yeah. So, and I think it's so much more empowering for them when they're working on something that they are passionate about. The motivation, the intrinsic motivation is so much higher when they feel like they want to do this, um, for themselves because it's going to get them somewhere, or they don't want to do something because that's what's best for them, rather than us telling them you can't do this, yeah, because this is bad for you, right? I think the relationship is so much more um, positive, and I think the outcomes are so much more positive. And personally, I feel like it's more rewarding because, like, with a lot of my clients, and even, like, with what we see in our system, with people sharing their goals, um, there is so much conversation about what's important to them. They'll be sharing pictures of their kids' graduations, and grandkids' graduations, and weddings, and this and that, like things that are personally meaningful to them, and you get to know them as this rich, amazing human being. Get to appreciate that.
Absolutely. And I think that's part of what draws people into practicing integrative medicine, is having more of that connection.
Mm-hmm.
But I think the other thing that you mentioned, outcomes, and we're really starting to get better data on that. I was just reading an article this morning that was looking at standard of care treatment for diabetes versus a more holistic lifestyle medicine intervention, and the difference in remission between diabetes in the control group and in this lifestyle medicine group was 30 percentage points. That's massive. And the only
Wow.
real difference is that you kind of involve them in the process and are giving them the tools and the resources they need to go out and change their life, instead of just, monitoring their blood glucose, properly putting them on some sort of medication. So I hope that as we get more of the research out there, this will become more standard of care.
Speaking of research, can you tell us about some of the research you've conducted in both Eastern and Western medicine?
Yeah, for sure. In fact, I was just thinking about that, Jeanette, as you were saying, and we were talking. I mean, I think there is applying a personalized and a whole health approach to care. Um, it's not just good for the individual, but it results in very positive outcomes, and I think we are starting to see that, and we need to do more and more research in this area. And I think some of the challenges that we have had traditionally with this research, which is a little bit tricky, is a lot of our research tends to be standardized, but here our goal is to personalize it for that individual, right? And secondly, a lot of research, when it comes to integrative medicine research, there are small studies, and there are very few large studies. So many researchers or clinicians in integrative medicine have um, don't have financial support, even though they have great desire to conduct research in this space, or
That's
they
so
may
true.
not have education about this, right? On how do I conduct a study, because they have not been trained to do this, right?
You are reading my mind. That's actually one of my favorite things about our program, is every single course focuses on the literature and research, but they actually have an entire course about how to properly design research studies, because they don't
Fantastic.
get that training.
Right, they don't get the trainings. I think it's so important, to like look at these different factors that are that that impact our ability to do research, and that's kind of what I have been working to address, or we address in the, like you are addressing, Lee, in your program. We are addressing that through technology. We literally have a virtual research platform at Helpsy that is used by many, many holistic researchers and clinicians and academic folks, and supplement companies, other technology companies doing research in whole health approach, because this way they can learn. We try to help them to understand how to conduct research and educate them or connect them to services or consulting or guidance with different organizations such as yours. Give them a tool to be able to do research and establish collaboration between different organizations, and do it at very, very low cost, something that most people can afford out of their pocket. So that's kind of where we are going with this, with the research, where we are today. Jeanette, I didn't fully answer your question, but I'll come to it. uh, um, that's where we are going with this. And we have right now researchers on our platform um, who are conducting a research where they're collaborating across continents. The same study is going on across 2 to 3 continents. So I think that's where we can truly empower integrative medicine, integrative nursing, whole health approach to nursing, by providing education and tools to make it really possible for everyone to do research. And I think the second aspect of research, where this is where I'm spending my time, and the second aspect of research is real world evidence. We can conduct studies and create these controlled environments where we do studies and we measure things and we need to do that because we need that initial data to understand what works, what doesn't work. Can we really say that with a certain level of confidence? But beyond that, what we need to see is what happens in the real world, and can we collect that real world evidence data to see what that is telling us, what is the evidence there of what works, what doesn't work. Because here we may be seeing factors that we may not have even thought about. And with the work that we are doing at Helpsy, we enable passive data collection, and trying to understand what is the data really telling us about the population. So if we see a certain percentage, a high percentage of individuals with cancer staying up at night, and 2 o'clock they're chatting with the bot about financial support and financial needs, or they're worried about certain topics. That's an indication that these are important topics to individuals, and it's something on their mind. And when you start to see not one, not two, not 10, but 20, 30, 40% of people thinking and looking at that, then that's an indication of things that are going on. So whether it's at a social determinant level or it's at different symptom level, there is a lot that real world evidence data can tell us, and that's something that is my current area of interest, and a place that I really want to expand the knowledge and further the field of integrative health, integrative nursing in this area. So that's what I'm doing right now. Where all of this started, going to your question of what research I've done, I've kind of had this bend of asking questions from the beginning. So even when I was, so I grew up with Ayurveda. My grandfather was a Vaidya, renowned Ayurvedic Vaidya. So I grew up with the Ayurvedic medicine and learned to read those first. Before learning, even reading textbooks, I was reading Charak and Ayurveda. But it was always with a very scientific mindset. So even when I decided to go back into healthcare and with the goal of serving, helping people to have good quality of life, empowering people, I was always thinking about, okay, what's the evidence behind it? Even when I was studying Ayurveda again, formally as my second career. So even for small things, like I was studying about the antibacterial properties of different herbs. So I literally went to microbiology lab and I plated all those antibacterial herbs on different pathogens, and cultivated them to see whether it really did have antibacterial properties, you know.
Mm.
So and then I found some interesting outcomes. Some was because of quality, so I then redid it, and then some was where it improves the immunity of an individual, so it works at that cellular level while others work directly. So I think that, had that mindset about research from early on, or that's just the way my mind functions. So I've done a lot of things like that. And then when the UCSF study that I got involved in, it started with me having this very interesting conversation with the PI who had done studies in yoga, and we were talking about how there is uh, standardization in medicine, but we cannot study um, Ayurveda or personalized, a personalized care plan. And it started with this whole issue about this, and saying, well, it's and my point in this was, it's not a limitation of the modality, it's a limitation of the research method if we cannot measure
Absolutely.
right, a personalized approach to care. It's not a limitation of the modality. We have not validated the modality. So it started this whole conversation back and forth, very interesting, this amazing oncologist and integrative medicine researcher. So I started to work with him to literally write out this entire protocol manual on how we could do symptom management for cancer patients in a multimodal approach, but still be able to measure it with standardized scales and standardized tools across all of them. And he was kind enough.
You're speaking Lee's language.
Yes, absolutely.
Yeah, I think Lee can totally relate to that. So he was kind enough to engage my curiosities, and we worked on this together, and it got funded by NIH, and then I worked with him, and we had really good outcomes where we saw that with less than 40-50% compliance, people had 30 to 70, 80% improvement in their symptoms. And it wasn't just physical symptoms, it was quality of life. So it was physical, emotional, it was control of life, across most of the individuals. So that was very interesting. And in fact, when we were thinking of applying for the next level, I was thinking, well, to do this 3-year, 5-year study with 30, 40 patients, when there are millions and millions of patients who are in need of this service, how can we make it accessible to everyone? And NSF was kind enough to give us a grant to us and to UCSF to see if there's a commercial viability of the work that we were doing. So we again studied whether there was commercial viability to the work by conducting hundreds of interviews and doing like an entire patient journey map with over 300 individuals that we interviewed to identify those issues and solutions and the business model. And when it was validated that it was in fact a good business model and it's possible to provide these services as a technical solution at scale, that's how the organization came about. So that's kind of what I've been involved in earlier. Right now, I serve on NCI's NIH's Integrative Medicine PDQ. So we review the research that is coming out for cancer related to integrative medicine, and put together summaries or revise the summaries on these different modalities, different research that's coming out for healthcare professionals as well as for patients. And then for Society of Integrative Oncology and for MASCC, which is a symptom management community of researchers across the world, I serve as part of their innovation. I founded the innovation community within both those organizations, and I lead that work in bringing technology and tools and and ability to access a lot of these services, to collaborate, to do more research, to provide more clinical services and other things related to research. So my goal essentially, in a nutshell, Jeanette, is what I'm driven by is by empowering researchers to be able to do more, and by being able to translate research into practice and bring that to the whole planet, if I could.
I love it. That's my goal too.
Yeah, let's do it together, right?
All right, let's do it. Wonderful. Well, it's been so lovely talking with you, and it feels like we could have done this for another hour. So maybe we'll have to have you back and check in and see what's new in your research. I would love that.
But also have you back to talk about Ayurveda.
Yeah.
I would love to be back here anytime. I love the work that your organization is doing in integrative medicine. It's so much needed, and I hear such amazing things about this service. So I'm here anytime, and I'd love to, for us to collaborate and serve the world together.
Wonderful. Well, it's all the time we have for today. So until next time, Stan, thank you so much for joining us.
Thank you.
This is the GW Integrative Medicine podcast from the GW Office of Integrative Medicine and Health.
I'm Dr. Lee Frame.
And I'm Janet Rodriguez.
Thanks for listening.